Okay. All right. So therapeutic communication, just bring it to me. Therapeutic communication is going to be a big bulk of exams. In Psych, you are probably going to pick the most untherapeutic communication that you would think of, and that's what we usually pick for our patients. Because most of them require boundaries and they need a strictness. You have to basically reparent them because they were not parented, most of them, okay? So now is not a time for you to be asking why, or I don't know, you're not supposed to ask why, but like, tell me more about, I don't want to know about that. Okay. So if a patient is like going up to the door of the unit, okay, and they're like trying to get out, they're like, I want to get out, I want to get out. Tell me why you want to get out. No, girl, I don't care why you want to get out. I'm going to tell you, you need to go back to your room right now. Okay. So you're going to pick the most like strict, firm, probably is going to sound like the rudest, boundary setting. You have to be a mom in this course. You should do great. Okay. You have to be a mom in this course. Be very clear with your boundaries. Tell the patient exactly what you want them to do. Okay. There are very few times, I will tell you when they are, but there are very few times you're ever going to say, tell me more about that. Okay. Because think of it this way. You have a schizophrenia patient, right? And they say, the devil's stabbing me. Why do you think he's doing that? Tell me where that, no, there's no rhyme or reason to that. You can't say that because to him, he feels it, right? So you would have to say like a schizophrenia patient. Oh, and that brings up a good point. Every disease process has a different way you're going to communicate with it and a different choice for therapeutic communication. Okay. So for schizophrenia patients, because they do not have a root in reality, and what their reality is literally what is happening to them. So this man literally sees demons and they are stabbing him in the chest and he can feel it and he is in pain. So I can't tell this man the demons aren't real because to him they are. He sees them, he hears them, he feels them, right? So you have to say, that sounds so very scary for you. Let's go over into the day room away from this. I wouldn't say away from the demons because I'm not going to feed into that, but I'm just going to say away from this or away from this situation, and you're going to divert them into something else, okay? Patients that are rooted in reality, though, I can straight up say you a liar without saying you're a liar. So for instance, let's say that you have a patient that's borderline personality disorder. Now, borderlines are very manipulative, and their goal in the psych hospital is to manipulate you and get whatever they want, right? So you guys were my nurses, you were my night nurse, and you were my day nurse, and I'm borderline personality disorder. So I come in today, I'm like, what's your name? What's your name? Colby, hi. Yeah, my nurse last night was absolutely freaking terrible. She hit me several times because I wouldn't tell her like what my feelings were, and I didn't even know her. And so I don't really want her to be my nurse at all anymore because she abused me like all night long. So I, as the nurse, would say, I find it very hard to believe that she hit you. That's a very psych way of saying liar, liar, pants on fire. Okay. But I wouldn't say that to a schizophrenia patient because their reality was their reality. They literally do see demons or sphinx or whatever. Do y'all see what I'm saying? So every disorder will have a different way to communicate. And I'll be very clear on that on the modules. Like you will know exactly how to communicate with that patient. Okay. But there are lots of defensive mechanisms that all the type of patients use, and you kind of need to understand what those are going to look like. But as far as therapeutic communication, it is considered therapeutic communications like to set very clear boundaries and tell your patient what you want them to do. Okay. If patient's in the midst of an anxiety attack and they're having a panic attack, is now the time to say, has anything happened in the past week or so that could have made you feel, nah, we ain't talking about feelings. Okay. So take everything they taught you in your adult one class or foundations class, whatever, and that has to go out the window. We are not touchy-feely here. We are here to help people get better. Okay. All right. So with that in mind, we're going to start talking about some defense mechanisms. So on each of these, you will have a defense mechanism, what it is, an example of a way that it is used and well, like you can use it in a good way, and an example of how you would use it in a bad way. Okay. Because you're going to see people do this to you and you have to be able to identify that therapeutic or that non-therapeutic communication. These are called defense mechanisms. So remember I told you that all emotion is heat, right? And if we don't get that out of there, then you either will do one of two things. You will either continue to push it out and you will get physically ill, or you will try to displace all of your shit onto somebody else and make it their problem. Okay. And that's where these really messed up families come from. You with me? Okay, so let me explain this a little bit more. So the first two are actually good defense mechanisms. The first one is called altruism. All right. So y'all have heard of somebody who's altruistic. Have you heard of this before? No? Yes, no? Okay. So that is somebody who deals with something bad happening to them by helping other people. Okay. So an example of that in a good way would be a nurse who lost a family member in a fire, decides to become a volunteer firefighter. It's the people who take their tragedy and turn it into something great. That's a great thing. It is considered a defense mechanism because I'm trying to defend myself, right? Not against an intruder per se, but just against this grief, right? And so I'm finding a way to turn that into something positive. You with me?
Not I became a volunteer firefighter to I guess they're trying to save somebody else from their pain.
Yes.
Right. But then also is that not kind of like role playing? Like you wish that you would have been a volunteer firefighter when your family member.
Absolutely. So it's a way to rewrite your story. Okay. And we do this in therapy too. We have patients rewrite their stories all the time. So let's say that the patient, I really want to put this on any of you. Let's say a patient was physically abused by her father when she was a child. And it has just really stayed with her very, very heavy. She's afraid of men. She chooses all the wrong men, right? She never feels safe in a situation. She doesn't even feel safe in her body. So you're going to ask her about one particular situation that was like the worst time she can remember her father hurting her, right? So let's say that she remembers that her father was punching her, was kicking her, burning her with matches, okay? And this obviously ended horrible. She ended up in a closet and she was crying and she was hurt. Nobody sought care for her. And that's a horrible way for that story to end. Your brain thinks that's the ending and that is your story forever. So what we do in therapy is we back that up and say, as that was happening, what did you want to happen? Okay. And some people will say, I wanted my uncle who always protected me to burst through the door, grab my dad by the throat and tell my dad if he ever hurt me again, then he was going to kill him. And then my dad never touched me again. And we have them walk through that in their mind to rewrite the story to tell your brain there was a different ending to this. So you don't have to keep reminding me of it all the time. Do you see what I mean?
Mm-hmm.
Okay. The next defense mechanism is called sublimation. Okay. So what is sublimation? Somebody can just read it if you don't know.
Substitute, is that if that's why you're not supposed to wear certain scents or something working with patients, because then they'll think that they replace the person in their story.
But we take our bad feelings, like the bad crap that has happened, and we replace it we want to do something bad, but we have to replace it by something that society won't think that I'm a psycho. Okay. So the examples that we gave here, a person who is really pissed off and angry at a supervisor starts working out vigorously at the gym and said, now, if he's really pissed off at a supervisor, he probably wants to punch the dude in the face. But socially, that is not acceptable. So we will substitute another physical form to get that anger, that heat out. You see what I mean? So, you found out your boyfriend's cheating on you and you're so pissed. You just go run 10 miles. You're yeah, screw him. Okay. Instead of going and pumping his tires like we want to, So it's taking something. Sublimation is basically kind of substituting a proper way of behaving. Yes, replacing the outlet. That's good. All right. Then all of the rest of these are typically going to have a maladaptive use. So y'all know what to suppress something means. Yes. Okay. So that is voluntarily. That's very important because we're about to talk about suppression versus regression or repression. Suppression means to voluntarily deny unpleasant thoughts and feelings. Okay. So let's say, in this example that I gave you, a student puts off thinking about a fight that she had with her friend to focus on a test. Okay, that's okay because you're only doing it for a short period of time, right? So let's say you were just about to go into an exam and your husband's like, why didn't you wash the dishes? Right? And you want to kill him, right? And then you're like, no, I'm not going to let you make me angry right now because I have a test to go take and that's most important to me. So I'm going to go take my test. Okay. You do you. Okay. I don't care what you do. Do the dishes. Don't do the dishes. I don't care. I'm going to go take this test. Now, when I come back, you're about to see this wrath. Okay. But that's okay because it's temporary. Right. You see what I'm saying? A maladaptive use of that would be a person who lost his job, says he'll worry about paying his bills next week. Bro, those bills are coming for you. Okay. And then they'll just keep voluntarily pushing you. Oh, no. It's fine. It's fine. It's fine. We have people that do this with medical appointments. Right? Maybe their mother had breast cancer and they found a lump and they're too afraid to find out what it is. So they're like, oh yeah, I made an appointment. And then they cancel that appointment. And then they make an appointment for a couple weeks, then they cancel it. And they're doing it voluntarily. I know I'm putting this off because I cannot face it. Okay. Now let's compare that with repression. Okay. So repression, you see where it says unconsciously putting unacceptable ideas, thoughts, and emotions out of your awareness. So suppression is I'm going to put my foot on this neck for as long as I can. Repression is your body is naturally doing it for you. Okay. So how would repression work in an adaptive way? A person preparing to give a speech unconsciously forgets about the time when kids laughed at him on stage. in elementary school. Okay. So you would have to, like, if you were going to give a speech again, and you know that that had been an issue in the past, but you kind of just sort of forgot about it, you know, and maybe you get triggered while you're on the stage, right? But you sort of repress that memory. So now you're actually able to go back and go onto the stage and be brave again. Okay. Now, what is a maladaptive way of using repression? A person who has a fear of the dentist continually forgets to go to his dental appointments. Now, he's not forgetting on purpose. I know, but it's like, did I forget on purpose, or did I really push it down so much unconsciously that I didn't write it on my calendar? I didn't. You see what I mean? So, like,
I was afraid of it, so I didn't want to see it. I didn't want to be
I didn't want to be reminded of it, but then I forgot it, you know? So suppression, I am purposely suppressing things. Repression is like, I guess I just keep putting it down, and people can repress thoughts, emotions, and feelings, and they may or may not be kind of aware of what's rising up. So we said all emotions are heat, right? And so let's say that heat finally is like, girl, it's time to visit this, and it starts rising up, and you start crying about something like a commercial, and you're, nah, I'm not doing that. That's weak. That's stupid. That's stupid. And you put it down. Okay. That is another form of like, but why can't I cry during a Hallmark commercial? You know what I mean? Okay. So suppression and repression both can be very maladaptive. You at some point are going to have to deal with it because those feelings are going to make you do so. Do we understand? All right. Next one is regression. Are y'all clear on what regression is?
Yep.
Okay. So that is usually when you go back to a period of time, okay, that you felt safe. Sometimes this is very normal, like in kids do this. Okay. Um, and it is very normal and it is very adaptive. Okay. So why would a child do this? Like, let's say mom just had a new baby and she has a 2-year-old in the home already. So why would this baby start acting like, or this 2-year-old start acting like a baby?
They want the attention.
They want mom's attention. So they go back to her and are like, oh, this baby is getting all our attention. Stupid baby. I'm going to be the baby. Right. And then but we also can see regression in people that are doing it unconsciously. And their brains will revert back to a period of time when they felt safe. You know, I was at a child abuse clinic for 2 years. So I did all of the sexual assault exams and the physical assault exams for the county. And I had this girl come in, she was 10, and her dad had been sexually assaulting her since she was 3, but she didn't report it until she was about 10, right? Because they are terrified of their abuser. So we brought her in, we do a forensic interview. And then if they disclose sexual abuse in the forensic interview, then I see them for a medical exam, and then I'll refer them to the therapist, and they start therapy at the same center. So when she came in, she was a perfectly normal 10-year-old girl, and we're chatting, and I asked, like, what's your favorite thing in school? And she's in, like, 5th grade, whatever. And she likes science and she doesn't like math or whatever. And we're just chatting, right? And I usually play a game or something with them that's age appropriate so we can break the ice or what have you. And then while we're playing the game is when I'll start asking just like very, just kind of not pointed questions, but just tell me about your family or whatever. And she was doing just fine. And then I was like, tell me about your dad. And she like flipped a switch. I wasn't even talking about the sexual abuse. I was just saying, because I'd say, tell me about your mom. Oh, me and my mom do this. Tell me about your dad. She climbed behind my exam table and she curled into the fetal position and she started singing like a tiny little girl, like some kind of weird nursery rhyme. And I was like, okay. So that's how we were able to find out when the abuse started, because she would regress back to that age where she had felt safe, which was somewhere between 2 and 3. And that's sad. So some people will do it and she wouldn't have known she was doing it. So once we got her feeling safe again, like when I did the medical exam, we have a volunteer that comes in to sit with the girls, or it's boys too, during the exam, because a lot of times their parents are not supportive, which is super gross. And so there's always a volunteer there that's very well-versed in helping these kids through these exams, right? And so hers was bad, and I won't ever force an exam on somebody. But the only way that she would let me do that is the volunteer crawled up on the exam table and had their legs out this way, and the little girl was curled up underneath them. I guess more like you're holding a baby, but she was 10 and very tall, So all that to say, regression can be something a person purposefully does, like a child, and that's normal and adaptive, or something that somebody does because something horrible happened to them. Okay. All right. Do you understand these so far? How are we doing? Mm-hmm. All right. Next one is displacement. So this is where you shift feelings related to an object, person, or situation onto something that is less threatening of an object. Okay. So to displace, this one actually isn't, it could be fine. If you get super pissed off and instead of punching the person you're pissed off at, you punch a punching bag. Okay. Well, my feelings are fine. There's nothing wrong with my feelings, right? I just obviously can't punch a person. So I'll punch a thing. Okay. But a maladaptive way of using this is somebody that gets like a dad has a bad day at work, right? So he's mad at his boss and he comes home and he trips over one of his kids' toys. So he throws the kid's toy and he breaks it. I told you to move this. Okay, it's not the toy's fault or the child's fault. So he's displacing his anger onto something else. Okay. Reaction formation. Okay, this one's funny, and we do this all the time. Let me tell you what this is. This is basically when you do something the opposite of how you really feel so that nobody knows you're really kind of a jerk. So,
Also like women.
yes. Okay. So let's say I'm still in love with my ex, okay, and he gets this new girlfriend and they get pregnant or whatever, and I hate the bitch, right? But me, like, oh my God, I'm in love with him. So I'm like, let me throw her a baby shower. Yes, I am gonna throw her a baby shower. I am so happy for y'all. You see what I mean? Okay, so it's when people do like the opposites because they're trying to like overcompensate for their like shitty feelings. Okay. And we actually see this a lot in like blended families. Like let's say the stepmom really just doesn't like the stepkid. But she's like, man, I love this man. So I don't want to, I'm trying to like this kid. It's just very difficult. And so they go and like buy them things or take them on vacations or something, trying to get over the fact that they don't like the kid. Okay. Do you understand reaction formation? All right. Next is rationalization. We've all done this too. Where you try to rationalize your badass behavior, okay? And it's not rationalized. You're just a bad human, okay? Now you can maladapt, like this can be very immature adaption, okay? Like for instance, one I gave you was an adolescent boy says they must already be dating someone when he's rejected for a date. That one gets me because I have an almost teenage boy. I mean, that's his way of basically like rationalizing so he doesn't have to feel sad that she doesn't like him. I don't feel like that's maladaptive. That's kind of, oh, bless his heart. Kind of sweet. I know. Because I would say that to my son. I'd be like, oh, well, she's probably just, yeah, she's dating someone else, or maybe she's not into guys, I don't know. All right. So example of maladaptive use for rationalization. A young adult explains he had to drive home from a party after drinking because he had to feed his dog. And then they try to paint people into a corner to make you feel like a shithead either way. Like, for instance, if you
hungry.
Exactly. You want my dog to starve? Is that what you would rather me do? Y'all know people like this. Yeah, they're like sick and twisted individuals who have no coping skills. And so they always have to project everything onto somebody else. Okay? All right, next one. Can y'all stay for just a few minutes so I can get this finished? Okay. All right, dissociation. Y'all know what to dissociate means, yes?
Like take you out of it.
Yes, it takes your mental state out of it because mentally you cannot handle what you are seeing or what is happening to your body. Okay. Now, this can happen in a moment, or people can end up dissociating for the rest of their lives. Okay. So, what I mean by that is, especially in sexual assaults, I saw this all the time. The person will say that they either like floated up out of their body and they watched the assault happen. Okay. Or they just, did y'all ever see 13 Reasons Why? Did y'all ever watch that? Okay. When she was getting assaulted in the hot tub, you could literally see her face dissociate. Okay. Like, because at first she was fighting, and then all of a sudden you just see her turn her head and she just goes completely blank. Like, your brain will literally go somewhere else, and all this like stuff is happening to your body because it cannot, there's no way to deal with that shock. Okay. Now that's dissociation in the moment, but some people, their body never comes back in. Okay. I know that sounds really scary. But remember, your brain's job is to protect you, right? And because your brain cares about you so much, it knows that it cannot present this thing to you again. But you can't dissociate from one event and not dissociate from everything else. So these patients you'll see are dissociated from any emotions. But if I'm dissociated from my emotions, that means I also don't have the capacity to love or to get very close to somebody or to develop really deep relationships. So people can live in dissociation their entire life and they just don't care about anything. And it's not because they're rude, they don't care. They just don't feel because they have to separate their mind from their body. Because if they're like, hey, I do want to feel again. I want to love, I want to feel excitement and happiness. I have to pull that emotion body back in. And when I do that, I have to confront that thing that happened. And they're just not willing or able to do that. Do you see what I mean? Okay. All right. Denial. Y'all know what this one is. Now, denial can be innocent, and it was our first stage of grief, right? Like if someone says, oh, ma'am, we did get your biopsy back and it's cancer. No, it's not. No, there's no way. There's no way. That's a natural denial, and that's normal. Okay. But a patient who is informed that his son was killed in combat tells everyone he's coming home for the holidays. I find that really sad. It is a maladaptive way, but they're not doing it to them. Like, they're not doing it on purpose. They're just so in grief that they cannot get to any point of acceptance whatsoever. Like, they
So if it
can't.
just keeps going, like, oh, he wasn't able to come home.
Yes, they'll sometimes make up stories for a long period of time. And even if they know, people know, because if they have to say, like, he's not coming home, then it makes it real. It makes it real. And so they won't do that. Okay. All right. The next one is called compensation. This is big boy, little pee, right? Emphasizing his strengths to make up for his weaknesses. Well, we don't care how strong you are or great things about you. You can still be a really crappy person. What do I mean by this? Okay, so let's talk about adaptive way. An adolescent who is physically unable to play contact sports but excels in academic competitions. That's great, right? So let's say the kid has a cardiac disorder, right? But he likes competition. So he decides like to do, I don't know,
Mathletes.
thank you. What's it called?
Mathletes.
Mathletes. Yes. That's nice, right? A bad way of using this would be a person who's really shy, works at computer skills to avoid like all socialization. Now, I kind of like that sometimes. So I can understand where they're coming from, but the number one indicator of mental health and mental wellness is having a social and a support system, right? But you'll also see like really like narcissistic dudes do compensation, right? You will see abusive partners in a domestic violence use compensation. Like they will say, really, I provide for you. I buy everything in this house. You don't do anything. You just sit here and stay home all day. I'm paying for the least you could do is have my dinner ready. You don't have my dinner ready, then you accept those consequences. Okay, just because you make money for this house does not give you the right to abuse me and my children. Do you see what I mean? All right. All right, next one is identification. All right. So this is the conscious or unconscious assumption of the characteristics of another individual or group. Okay, what does that mean?
Like the boxes that we read earlier?
The what?
The cultural boxes?
Oh, well, that does play into it, but this is somebody who is now identifying. Oh, I gotta be careful how I say this.
Oh, I think I know. Like Kim Kardashian identifies on teaching that. I guess that's...
No, but these people like may become their abuser. Or what their abuser was. So for instance, they may change their identifications. Like a good use. A girl who's had a chronic illness, she's in the hospital all the time. Now she's the nurse for her dolls. That's a good identification, right? That's a good play therapy. She's able to kind of play that out, right? Example of a maladaptive use, a child who observes his father be abusive to his mother, then becomes abusive to children at school. You take on the identity of the abuser. This is the one thing that I could not understand when I was at the advocacy center, okay? The majority of kids who perped on other kids were because they were perped on first. So I could not wrap my mind around the fact that when they got sexually abused, that was horrifying, right? It was by an uncle or mom's boyfriend or whatever. And that had to feel horrible. Why would you then in turn do it to someone else? Like I could not wrap my mind around it. Okay.
Because they're told like this is love. This is how people who...
That's part of it.
Like...
But the biggest part was these kids felt so out of control because things were being done to their body without their permission. They didn't want it to happen. They couldn't say no. So then they flip the script and say like, oh, now I'm going to be the one that does it all the time. And I can say yes whenever I want. And somebody like, I don't ever have to say no. I'm in control now. Okay. So it kind of flipped the script for them. I don't think they were trying to specifically be harmful because a lot of these kids were touching other children and they were kind of doing like acting out some of the things that had been done to them. We know kids reenact everything that happens to them in their lives, right? So if there was ever like a kid that was perping on another kid, we would always bring the perp in as well, the kid perp, and then say like basically who did this to you, because kids don't know how to sexually assault other children. That is not something natural that you are born with.
Full assault.
Huh?
They don't understand.
No, they don't, and so they had to have seen it from somewhere. So identification basically means you're taking on that identity, and we see this. Have you ever heard of Stockholm syndrome? Okay. So, they take on, like, they become, like, in love or whatever with their captor, because this is a mental game. All right. Next one is called intellectualization. So this is where you separate emotion and logical when you're trying to deal with something. Okay. There is nothing logical about going through something very emotional or very tragic. Okay. But a lot of people who have that logical mind think like your engineers, your attorneys, you know, it is very difficult for them to deal with an emotional, massive response. Okay. So here's a good way of using intellectualization. A law enforcement officer blocks out the emotional aspect of a crime so he can objectively focus on the investigation. So I just saw this. I'm stuck on TikTok right now, and I go through these cycles where I get stuck on it for weeks on end, and that's all I do. And then I won't touch it for like 3 months. But I'm in a TikTok cycle, okay? And somehow I got on the crime side of TikTok. There was a little 10-year-old girl who woke up in the middle of the night, and some intruder had come in, killed her pregnant mother, her father.
Texas. That's where I'm from.
Shut up!
Yes, it is.
Oh my God! I just saw it yesterday.
I knew the boy. He was
Really?
below me. Yeah.
Oh my God! They never whole story.
Like it happened. I remember that whole day.
Okay, I'll finish telling you. Okay, so tell me if I'm just saying something correct. Okay, so it was a 10-year-old girl woke up in the middle of the night, an intruder had come in, shot her dad, her 5-month pregnant mother, and her brother, and he thought he had shot her, but she pretended to be dead for like 2 hours. Oh my God, I cannot believe you're from there. That is so wild. And I just saw it on my TikTok. There's some kind of AI going on in here. Okay. Anyhow, so she pretended to be like dead for like 2 hours. He left. She calls the police and says like there was a shootout at my home. Anyway, the reason why I was telling that story was because the cop said like as soon as he came and she saw him, she ran up to him and grabbed him and hugged him. And then they were like, oh my God, this is horrible, not having any idea what they were walking into, right? And then you walk into this horrific crime scene, a pregnant mom is shot, like that's horrifying. So in that case, you have to be like, this is my job, this is what I'm supposed to do. And this is big for you guys in nursing. This will be big. When you have child abuse cases, or you're having to deal with a fetal demise, right? Or you're dealing with, you have to care for a child abuser, right? Maybe the dad came in and beat the shit out of the guy, right? And now you have to care for him, you know? So you guys are going to have to use this a lot to split. Where is that place?
It's called Pampa, Texas.
Where is it though?
It's up by Amarillo.
Oh my God, I can't believe I just saw that and you're from there. That is why
Yep.
I watched the whole thing. It
It
was like 7 different parts, and I was like, oh my God, I'm really into the story. And it was just like a random dude that just walked in there. Oh my God, it's so horrible. Anyway, okay, we'll talk about it more later. I gotta finish this. Okay. A maladaptive way of intellectualization. A person diagnosed with a terminal illness focuses on creating a will, financial matters, blah, 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 right? So they'll come in and say, hey, sir, you know, you have very aggressive brain cancer. Okay. So he gets an attorney immediately and he's getting his will and testament. He's like, sir, but it's terminal. Like you're going to die in 4 weeks. Okay. All right. So let's get my affairs in order. Let's get the But you see, it's not. No, ma'am. I already know how you're going to be now.
That would, you know, you've got kids.
There's now we understand that is part of it.
I get this done. I get this done.
Right, but this is maladaptive soon, and you'll see it. You'll see it when you see somebody do it. Okay, if you are going like with a physician, and you'll have to go in, and it's like a young mom, and you tell her you have cervical cancer. It has invaded everywhere. I know you have whatever 5 kids, but you're only going to live for 4 weeks. And she immediately just goes, all right, well, I guess I got to call my job and resign. Do you see what I'm saying?
They're like crying and being
right. Like they're trying to like intellectualize this and well, I guess better do that and got to do this. That is somebody's way of, I'm not dealing with that. That's a busy person. Like that's a type of person. Somebody who likes to do paperwork and somebody who likes all the things in order. And so that is their way of controlling the situation. If they always have something busy to do, then they don't have to deal with the emotional aspect. Okay. All right. The next one is called conversion. These next 3 don't have any good way of going about it. All right. So conversion, responding to stress through the unconscious development of physical manifestations not caused by a physical illness. What does that mean? Responding to stress through the unconscious development of physical manifestations not caused by a physical illness. Have you ever heard of a kid that got like really abused or something really traumatic happened, or they saw a really traumatic event and then they haven't spoken since the event? That's it. They'll usually either lose hearing or their speech or something. It's psychological. There's something physiologically wrong with them. But conversion is like basically converting to a disability so that you don't have to deal with that issue. Okay.
Like if I don't have to talk, I don't have to talk about it.
Exactly. Because I don't even know how to form the words to say what I saw. It was so horrific. Okay. Splitting. You will have this question in multiple different exams. So this is very important. You understand what splitting is. Okay. And I always had the wrong idea in my mind. When I thought split, I meant they split the nurses. Like that's what I thought. Like, remember how I did that example earlier? When I was saying like, oh, she's the bad nurse and I don't like her and I only like you and I only want you to be my nurse. Okay. Which by the way, I'm going to stop there for a second and tell you all this. So you can understand what I'm saying. If you have like a bipolar patient and she does that, which they like to manipulate, so does borderline personality disorder. And she's like, I hated that nurse. She was totally rude to me. She like hit me all night. I only want you to be my nurse because I really like you. Guess what the first thing you're going to do? It's the most therapeutic thing you can do for that patient. You're going to go immediately to the charge nurse and make sure she gets a different nurse every single day that she's there. And that's why people fail psych, because they're like, oh my God, that's so freaking rude. But no, what's her goal here? She's trying to manipulate you. And I'm going to give you all these compliments. I'm going to do all these things, right? Because I got my eye on you. Okay. So in order to prevent her from manipulating anyone's stuff, I'm going to give her a different nurse and rotate them out every day. Do y'all see how psych is a totally different way of thinking? Yes? Okay. So like, for instance, I'll give you a couple more examples before we finish. If a patient has schizophrenia and they say, oh my God, I'm seeing snakes and they're climbing up the wall. What do you say?
And they have schizophrenia?
They have schizophrenia. So are they rooted in reality?
No.
No. Do they see it? Yes.
So
can I do? Okay, but I have to acknowledge his feelings first, right? Okay.
You sound scary.
You sound very scared. Yeah. So why don't you want to walk to the day room with me, or do you want me to walk with you down the hallway? Because I cannot. The only thing I can do is empathize with his feelings, but I also don't want to give into solutions because I don't see the shit on the wall, right? So I'm not gonna say like, oh, let me kill the snakes for you.
They don't do that.
We don't feed into their delusions, but we also don't tell them that their reality is not real. Okay. But that's on somebody not rooted in reality. Okay. If you have patients that are rooted in reality, like personality disorders, their number one job is to manipulate you. That is their goal in life and they love it. Okay. So your goal in life is to make sure they don't. Right. Okay. So you see her coming in here all the time, right? Okay, because she knows eventually I'm going to get annoyed, right? And I'm going to give in. So she knows I only have to do that like 4 or 5 times, and my mom's just going to tie the balloon for me. That's how they do that on the unit. So they're going to keep doing the same thing over and over to you, knowing that eventually I'm going to hit the jackpot here, right? So what's your number one thing with those patients? Consistency. And I'll tell you no 1,000 times. And I'll just keep saying the same thing over and over again. I already told you that is not allowed on this unit. Okay, so if the patient comes and says, it's really not fair that I don't get to eat in my room and I have to go to the cafeteria. You understand it is our role to eat in the cafeteria. That is your therapeutic communication for these patients. So we're not always going to pick the touchy-feely. Okay.
Well, and then the moment that you like kind of give,
Mm-hmm.
and then it's just.
Right. Because if I start empathizing with that patient, right? Mm-hmm. Oh, it must be so hard to have to eat in the cafeteria. They're like, hey, she feels sorry for me. It is. One time, my dad hit me in a cafeteria, and so I don't want to go back in there again. See, they'll try to get you. Do you see what I mean? Okay. So it is very important with like personality disorders that you keep. And I'm not saying there's never a time where you're not going to say like, tell me more about that. Right. But it's like there's hardly ever a time you're going to say, tell me.
You're a nurse, I'm a therapist.
Right. Because my job on the unit is to keep myself safe. You okay? Okay. And to keep everybody else safe. And most of that is going to be basically just bossing these children around and telling them where to go. And I don't mean to be rude by calling them children. But what I'm trying to say is that's kind of how you have to do it. You know, just like with your own kids, you have to have boundaries and stick with it. Because if you cave one time, then your kids know you're going to cave. That's why they always ask dad for things, right? Because dad will eventually be like, God, stop, leave me alone, you know? All right. Next is, I was talking about splitting. Sorry, I didn't finish that. Okay. So in splitting, a lot of patients that are very emotionally immature are not able to see any gray areas in life at all. Everything is black and white, okay? So when they're doing splitting, they either see you as all good or all bad, and there is no in between, okay? So let's take that situation I gave you earlier. I was bitching and complaining because you were my nurse the night before, and I said you hit me, and you didn't like me, and she just hates me, so I want you to be my nurse all the time. I love you so much. Please, let's just hang out and braid each other's hair. And then, so she loves you. Yes, you're all good. You just got here, you know? And then you go and tell the charge nurse, like, she's attaching to me. And I really think we ought to give her a different assignment every day. Well, she finds out you did that. Okay. Now, normal people would be like, why did you do that? That really hurt my feelings. You know, I thought we had a bond. Maybe I misunderstood. But I really wanted you to be my nurse. That would be like on a normal med surg unit, right? This patient's not going to do that. You stupid bitch. You hate me too? Oh, that's fine. You guys can just go and hate me together. Okay. So it's all good or all bad because there is no gray area. Do you understand? All right. Next is projection, attributing one's unacceptable thoughts and feelings on somebody else who does not have them. Okay. Y'all see this in abusers all the time and cheaters. Yes. You're cheating on me. Give me your phone. Give me your phone. Give me your phone. Well, let me see your phone. Oh, no. They accuse you of doing the exact same thing that they are doing to alleviate their own guilt. Do you understand? Case in point. Okay. Do we understand these? No. Okay. So they may ask you like different ones of those and you